Today we're going to talk about renovascular disease. Renovascular disease is the narrowing of the artery to one or both kidneys. Renovascular disease can cause high blood pressure and reduce kidney functions. Some patients get acute kidney injury or chronic kidney disease, which are topics for another day. Both can require dialysis, which is a treatment that filters and purifies the blood using a machine. This helps keeping your fluids in balance when the kidneys can't do their job. Renovascular disease is often overlooked as a cause of high blood pressure. Who are at risk? If you smoke or are overweight, you are at greater risk of renovascular disease. Renovascular disease is most common in 50 to 70 years old. It can also occur in women and younger adults. High cholesterol, diabetes, and other heart disease are also risk factors. Hypertension is both a cause and a result of renovascular disease.
Okay. So as you may know from the biology class, if you took it or not, I don't know. The kidneys, one of the kidneys' main functions is to fill out the blood from excess water and like things that you don't need, like dead cells or something like that. So what happens is cholesterol, fats, dead cells, they build up to make something called plaque. This plaque builds up on the inner wall of the arteries. As we know, arteries is it's what brings blood from the heart to the rest of the body, and the arteries connected to the kidneys gets blocked and narrowed by this plaque. And what happens is that your kidneys cannot access blood properly, or your body cannot access the kidney properly, and you end up with a lot of complications. Complications, your kidney gets damaged. This process of plaque hardening and narrowing on the arteries of your kidney is called I don't know how to pronounce this word, but it's atherosclerosis. And yeah, risk factors include cholesterol, smoking, diabetes, and obesity, just because that's all of these things build up in your blood and they contribute to this plaque that blocks the inner wall of the arteries.
How do you know you have RVD or renovascular disease? Renovascular disease can be silent. The first sign may be high blood pressure that stays high even when you take tablets. This alone is insufficient to give a diagnosis of renovascular disease. When starting treatment for high blood pressure, doctors often measure kidney functions before and after starting tablets. If kidney function worsens after taking tablets, this can be a sign of renovascular disease, and tablets should be stopped until this is investigated.
Okay, so how is it diagnosed? Does anybody know what a stethoscope is?
I heard it before, but I don't really know what it means.
I'm pretty sure you have seen.
It's the one that measures your heartbeat, or to hear your heartbeat. Right?
Exactly. It's the headphone-like thing that you use to measure your heartbeat. What they do is if any signs come up, they use that and put it in your abdomen where your kidney is. Like your abdomen is outside of your kidney, but I think you know what I mean. Like next to your groin area, not like I don't know. And they put it in your abdomen, and they see the blood flow next to your kidneys, and if there's any blockage or anything that they just hear the blood flow. They just see the blood flow and see if there's any interference next to your kidneys. to diagnose it specifically and make sure that you do have this disease, they take MRIs, which is like it's basically the same thing as X-rays, but it's like I don't know what's the difference exactly. I might need to research it. But they just take close measurements to specify exactly how this is, if you have this or not. Good. Okay, so treatment. If a patient does have RVD, which is the renovascular disease, first thing they do is make sure that it's not getting worse and there's no more building up of plaque in your arteries. What they do is they try to regulate your blood pressure. And third thing they do is they try to relieve the blockage. So basically, they make sure that it's not getting worse, and then they try to decrease the blockage.
Thank you for your attention. The presentation is over.